The new plastic surgery trend is perhaps something you may not have thought of.
Okay, joining us right now, Dr. Richard Chafu. Doc, good morning.
Good morning.
Okay, what is happening here? What are people coming? They're asking to change certain things because of social. Explain what's happening.
Well, part of what's going on, Raul, is social media, Instagram, Snapchat, Facebook. We're all interconnected, and so people are looking at changing some of their looks. One of the things people are talking a lot about is photographs of the bare midriff area where the belly button. So people are looking at trying to get their belly button changed. Making it more into what we call an aesthetically desirable belly button.
Wait a minute, so let me get this right.
The belly button?
So they see a picture like that and they say, Lord. Just like they would say, I want that nose.
Yes.
I want that whatever. I want that belly button.
Yes.
And there's a surgery to do that?
Well, it's a good talking point, Charlie. So when they come in, the important thing I like to ask a patient, well, what do you find attractive about that photograph?
Yeah.
What is it? Because obviously we can't, just like we can't take somebody else's navel and put it on their body,
right.
We can't take that nose and put it on another person's face. It may not look right, we may not be able to do it anatomically, but the belly button typically, if you look at it aesthetically, tends to be more vertically oriented, so more of an innie versus an outie.
Right.
And there's a certain aesthetic shape and position to it. So it's important to look at that and then look at the patient's anatomy. Some people actually have hernias that can be repaired at the same time.
So if you want to change the shape of your belly button, whether it's an innie, an outie, whatever it is, how would you go about doing that?
So the way you would go about this is looking and seeing what their anatomy is. There's an incision that's made around the belly button, actually on the inside, so there's no outside scar. It's all done so it's hidden within the shadow of the belly button, if you will.
Okay.
Oftentimes it can be done under a local or just some sedation. It takes about an hour to perform. The stitches that we put in are dissolving, and oftentimes we will change the belly button in relation to other procedures like mommy makeovers. For example, if a woman's belly button is changed, it's usually due to changes with pregnancy, multiple pregnancies, and then they have some extra skin and they're having a tummy tuck done at the same time as changing the belly button as part of the operation.
Are all these things what's called the umbilocoplasty procedure? That's what that is?
That's part of making a new navel.
But this all comes back to even the Snapchat. We look at a lot of social media, and can I just be honest with my friends too? There are some times that you see me without makeup, but some of it is filters, it's filters. People don't really look the way that they do on
And that's a great point that you make, is that there are filters, there are morphs that go on, and that you may not necessarily be able to create that with surgery. We all heal differently, we all have different responses.
Exactly.
I had 2 young girls come in the office the other day, and they have a huge Snapchat and Instagram following, and one of the girls said, well, I don't like how I'm posing for pictures, and she kind of showed me how she would pose, and she had a little bit of a bump on her nose, so I mean that's realistic that you could make some changes to her nose, but computer imaging is helpful, but you're right, it's just a starting off point. You have to make sure that you explain to a patient that what we can do surgically may not necessarily be duplicated by what you could see on a Snapchat or Instagram image.
So like a Snapchat dysmorphia or Instagram or whatever, that is legitimately something you're seeing now.
We are seeing it, yes. Also we're seeing more now, even with, if you think about we're FaceTiming and people are looking at their own images and saying, well gosh, maybe there's something I might be able to do to improve that.
That's when we've said here in TV, it's like never put the camera down shooting up at you because it doesn't look as good as
you know what?
That's why Shali's constantly taking her selfies like this.
Well, it's obviously more flattering when you take it, but Dr. Chafu, let's be fair. For me, I like to be as real as possible, and I will post my face with no makeup on.
Yes, you will.
What I really, 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 really look like, because I understand too, Raul, what happens that people think, well, oh, she looks like this, and no, I look like you at home.
And the technology, has become so advanced. Unfortunately, it's sort of ahead of us, because I remember when I first got my phone and I was talking to my daughter, and I said, well, there's another call coming in. There's an old guy talking. Let me see who it is. And I realized that as that person was talking, it was actually me.
Oh my God.
It was my mouth moving. I'd FaceTiming myself, so I was like, okay, I understand why people come in now, because they see something they don't necessarily like.
It's a whole new age. This is giving us new perspectives on everything.
Love yourself.
Right.
That's
Dr. Chafu. Wow, that's fascinating, isn't it?
It's very real. It's very,
real.
very
He's here
real.
to help people.
Yeah.
I love that.
Thank you.
Thanks, Doc.
Thanks,
Appreciate
sure.
that. You look like all of you at home? What does that mean?
What I'm trying to say is I'm a real
I don't
real
look like you at
person,
home.
And I get like visitors on my face, and you know, like it's real. I have dark spots. I get red eyes. I'm just like you at home.